Okay, so we're going to discuss skin, nose, and mouth care, or care of a person as they are approaching death. As a person is approaching death, we definitely need to be caring very carefully for their skin. They may need more frequent baths, typically bed baths, changes of their linen. If they're sweating a lot, their beds are going to be damp, and so those are going to need to be changed. We're going to need to turn and reposition them frequently. Taking care of their mouths. They're typically mouth breathing a lot at this point, so we want to moisten their mouth with a swab, giving frequent oral care, offering ice chips, using lubricant on the mouth and the nose. Don't forget about pain control and how critical that can be. Always be observing and reporting signs of pain and adjusting the blankets for comfort. There's senses can be diminished. The best lighting for a person who is passing is a softly lit room. You want to remember alternative forms of communication, and remember that hearing is usually the last thing to go. So explain to them what you're doing when you're cleaning them, when you're turning them, because they can still hear you even if they can't speak. They may also have some breathing problems. And so if you notice this, you may want to elevate the head of the bed or change their position, or you could report it to the nurse. Sometimes if they're on hospice, they may have a certain medication ordered that can dry up some of the secretions and help with that breathing issue. Food and fluid usually becomes an issue also at this point. They usually stop eating and drinking. We do want to offer but not force. Remember that they may have nausea, vomiting, and diarrhea. If they do, let's go ahead and report this to the nurse. And don't force them to eat anything that they don't want to. Your attitudes and feelings about death can be influenced by many things. So your experience that you have with death, if you're somebody who's never been to a funeral, never been with, had a loved one that's died, might be different than somebody who's gone through that quite a bit. Your personality type, your religious beliefs and cultural background, all of these things can impact your feelings and attitudes about death. Remember that as you age, as you go through adulthood, your attitudes about death will change. So how you feel about it when you're a teenager will be very different when you're in your 40s or 50s of how you feel about it. It does change as you gain more experience through life. One of the biggest fears that people have is dying alone. So if you have an opportunity to spend a little extra time with that person who is passing, especially if their family or their loved ones can't be there, please do take that time. That is a common fear that's expressed. When a person is dying, all body systems are affected. So it's important to know the signs of approaching death. And there's a whole bunch of them. I'm not going to read them. You can look through. But I'll just hit on some of the highlights. And there is some videos that I attached that talk about signs of approaching death. Some of the things that you might notice is that they may start becoming cyanotic. Their skin might have some mottling, which is like a bruised, kind of a lacy look to it. They may have some real heavy perspiration, and sometimes they'll spike a really crazy high fever there as they get closer to the end. Their jaw starts to drop. They may start losing feeling in their legs and feet. They may start having more loss of vision, inability to speak, more confused, very drowsy, where they're sleeping all the time. As they get closer to the end, there's a lot of sleeping. There may be some hallucinations. Their blood pressure might start dropping. They might have a change in their vital signs. So be aware of those things. The nausea, vomiting, difficulty swallowing, dry mouth, all of these things are affected as they're nearing death. Their urinary output is going to decrease because their intake is severely decreased. And then they may have that loss of hearing, but that's usually one of the last senses to go. Remember, as death nears, sensation of pain may decrease. So they actually may seem like they're getting more comfortable the closer they get to passing. So know your signs of approaching death, because there'll be questions about that on the test. But there's also going to be questions about signs of death. They're not the same thing, okay? Approaching death means you're getting closer to dying, and death means you have passed. So signs of death are no pulse, no respirations, no blood pressure. The jaw drops, the eyelids are usually partially open, the pupils are fixed and dilated. Dilated meaning big, okay? They're big pupils. And they may become incontinent of urine or feces. Rigor mortis is something that sets in typically 2 to 4 hours after death, and this is a biochemical change that causes the muscles to become rigid or stiff. Sometimes a family may want to stay with the body for a while. If this happens, allow them to do that. Sometimes families, once the person's passed, they're ready to go. Don't be judgmental. You don't know the path that they've been on. Some people, it may be a relief when their loved one finally is no longer suffering, and some people just aren't ready to let go yet. So each family may respond differently. Remember to position the patient in good alignment, or the body in good alignment. They're going to be on their back, their legs are straight, you fold their arms across their abdomen. Be aware of those things. Close the mouth, and you can put a rolled up towel under the chin. And there is a postmortem care video I posted that has that on there. They do put like a shroud or a cloth over the person's face. I've never done that in my experience. I don't know of many places that do that. Typically we clean the body, and if you want to put a sheet over them, you can. But just find out what your facility's policy is on that. So then the last part that you need to know for the quiz, you need to make sure you understand the advanced directives. So we're going to quickly go back over that. Advanced directives are legal documents, and they let the person speak when they can't speak for themselves on what kind of medical care that they want if they're unable to make those decisions. So the first one, living will, that is in place while the person is still alive. Okay, it's a document that lets the person choose their medical care if they're unable to speak for themselves. So in contrast to that, a will goes into effect after a person dies, and that's usually about property or finances, belongings, things of that nature. Durable power of attorney for healthcare. This is a signed, dated legal document that assigns somebody to make those decisions for them. So if my mother assigned me as her durable power of attorney for healthcare, if she's no longer able to speak, I will make the decisions that I know that she would want. In contrast, a power of attorney is in relation to money, finances, property. And so when you give somebody power of attorney, they can sign your checks, they can talk to people over the phone, they have power over all your finances while you're alive and when you've passed. DNR is do not resuscitate, and so this tells them not to do CPR, and that's all that's included with the DNR. So make sure you go back over that, know the difference between the power of attorneys, the living wills, what an advanced directive is, and DNR, because you will see several questions about that on your quiz.